Senator, your response today to the commission or the group that met in the White House, do you take this as an encouraging sign, or does this look like essentially a photo op?
Well, good evening, Chris, and thanks for having me on tonight. Look, I'm encouraged that the White House is turning some attention to this issue. The heroin, fentanyl, and opioid epidemic is our most pressing public health and safety challenge in New Hampshire and across the country. But we need urgent action, and we know because so many of us have been dealing with this, so many of our constituents have themselves or have friends or neighbors or coworkers who are suffering from substance misuse. We know what best practices are. We know what we need to be doing. More than anything, we need to support and encourage more states to enact Medicaid expansion, because in my state it was our bipartisan Medicaid expansion program that for the first time offered treatment to thousands of people who needed substance misuse treatment. We also know that we absolutely need those essential health benefits. You just played the clip of Congresswoman Clark talking about that. Before the requirement that insurance companies cover substance misuse treatment, they often didn't. And so it's really critical that the administration stop trying to roll those efforts under the Affordable Care Act back and support expanded treatment. And then here in the Senate, I'm a co-sponsor on 3 different bills. The STOP Act, which would help us crack down on fentanyl importation into this country, the SALT Act, helping us crack down on synthetic opioids, and then the Lifeboat Act that Senator Manchin is championing, which would create a permanent revenue stream for treatment funding.
What do you think of the argument that the president has repeated time and time again on the campaign trail, and he was today, that the border is the source, in some senses, of the epidemic, despite the fact that the numbers clearly show this is overwhelmingly a product of domestic consumption of prescription drugs?
Well, look, it's always important to crack down on the importation over the border of illegal substances and drugs, but our law enforcement were some of the first people in New Hampshire to say we can't arrest our way out of this. And that's why we came together in New Hampshire across party lines and expanded our drug court program, came up with additional funding for substance misuse treatment. We are focusing on prevention treatment and creating a robust recovery network, too. As our governors are doing this around the country. And what I would say to the president right now is we need urgent action because people are dying.
So you said, I've heard everything that you said, and I've seen other governors talk about the same thing, and I've heard you say that we sort of know what to do. But as far as I can tell from looking at the data today, which is stark, is that it hasn't gotten better, even under the implementation of programs like that. Am I mistaken, or is there just not enough? Are they not scaled up enough to deal with the size and scope of it?
Well, scaling up has been a challenge, so has workforce. We need more workforce in this area so that we can scale up. Medicaid expansion takes some time to be implemented, but the other thing to realize is that increasingly about 70% of the overdose deaths we've seen in New Hampshire have involved fentanyl, which is a far more deadly opioid even than heroin. So at the end of the day, this was an epidemic that grew out of addiction, in particular to legally prescribed opioids here in the United States. It is taking time to turn this tide, but we are going to reverse it. We are going to beat this thing as long as we understand the cause of the problem and we can expand treatment and, again, also build the kind of recovery network that we really need to do and continue to work with our law enforcement too. But we have to attack both the demand side as well as the supply side. And again, I'm very concerned that the president's event today, it was a first step, but we need urgent action because people are dying.
Senator Maggie Hassan, thank you for your time.
Thank you.